All right, this is the chapter on spirituality. Paying attention to the spiritual dimensions of health and well being is integral to holistic, person centered care. Spirituality is something that should be assessed with each patient and not ignored, as this is part of the whole person and treating patients holistically. Patients facing the losses and limits related to injury, disease, or even aging begin to evaluate what's important in life and often asks the big questions, right? Is there a God or a transcendent being? Does life have meaning and purpose? Am I dying? Is there anyone I can trust to be with me during this hard time? Nurses skilled in spiritual care are able to identify and elicit the inner resources of patients and family, as well as caregivers, to promote healing and health with sensitive and difficult topics, right? Spirituality is a dynamic and intrinsic aspect of humanity through which individuals seek meaning, purpose, and transcendence. Spirituality is not necessarily religion. Religion is a subset of spirituality. Religion may be a way in which people express their spirituality, but it's not the only way, right? Again, let me say that. Religion may be a way in which some people express their spirituality, but it's definitely not the only way. Religion is more focused on systems or social institutions of people who share common beliefs or values. Please read Through the Eyes of a Caregiver in your fundamentals book. Here are the learning objectives for this chapter. Please take a moment to review each one of these. If you can speak to these and apply these to your nursing practice, then you have accomplished your learning for this chapter. According to Shelley and Fish, three spiritual needs connect all religious traditions and are common among individuals. The need for love, the need for meaning and purpose, and the need for forgiveness. Nurses differ in their beliefs about how involved they should become in meeting a patient's spiritual needs. This is part of their well-being, right? It's part of the patient's well-being. And to ignore this aspect of the patient's healing does not align with holistic care, right? So we can't ignore it. Nurses should address a patient's spiritual needs by offering a compassionate presence, assisting in the struggle to find meaning and purpose in the face of suffering, illness, and death, as well as fostering relationships with a higher being or other people that nurture the spirit and facilitate the patient's expressions of religious or spiritual beliefs and practices. Please see the CUSIN reflective practice, cultivating CUSIN competencies. Those are important. In addressing this aspect of care, like developing cultural competence, you want to reflect on your own personal spirituality beliefs. Remember, we are here for the patient. It's not about us. I work with a nurse who's an atheist. She is an awesome caregiver, but she has a hard time praying with patients. And there are times when a patient will ask you to pray with them. She comes and gets me to pray with her patients if and when this occurs, because it just makes her too uncomfortable to do it. And even if she went through the motions of prayer with her patients, she feels as though it's disingenuous and she isn't respecting their needs, of their spiritual practices. So she comes and gets me to do that. And that's okay, right? So you can have that relationship with your peers and coworkers. Spiritual dimension is unique to individuals. It also, it may be given through their culture, their development, their life experiences, maybe organizations that they're connected with, all of these, right? No consensus exists about the role of the spiritual dimension in health. The integrated approach views each of the four dimensions as equal and also influencing each other, right? So looking at physiological, psychological, sociological, as well as spiritual, right? So we're looking at all four. The unifying model grounds the physiological, psychological, and social dimensions in the spiritual dimension. We gain a broader perspective of the spiritual dimension when it's examined from numerous theoretical points of view, including philosophy, theology, physiology, psychology, sociology, all of those, right? And the theoretical perspective guides assessments and interventions in situations of spiritual need as well as spiritual distress. There is a link in here if you'd like to read more about the different spiritual dimensions and how they're applied. This is through the MCC library, so you can access it with your student MEID and, of course, your login. Meeting spiritual needs. When people face difficulties in their lives, they will reach out to those around them to help meet their spiritual needs. Just being a compassionate, calming presence, holding a hand, or being a sounding board are many ways we can help our patients connect to their spiritual needs, right? Also ask your patient if there's a family or a friend member or a peer that you can call for them to speak to. At the hospital, we have clergy available who can offer assistance, right? So let's say they have a shaman that they want to come in, right? Our clergy just works with that patient's religious affiliation, and we get them in there to visit, okay? We can also reach out to the patient's own religious leader if they prefer, right? We do all of that. Spirituality is anything that pertains to a person's relationship with a non-material life force, or what we refer to as a higher being, right? Many times it's experienced as a unifying force, a life principle, essence of a being, or it's expressed and experienced through connectedness with nature. I mentioned that in class. I have a really dear friend hers is connectedness through nature, the earth, the environment, right? The cosmos, that kind of thing. Faith generally refers to a confident belief in something for which there is no proof or material evidence, right? That's faith. And it can involve a person, idea, or thing, and is usually followed by action related to those ideals or values of whatever their beliefs are. Religion can be defined as an organized system of beliefs about a higher power that often includes set forms of worship, spiritual practices, codes of conduct, those kinds of things. Closely related to spirituality, faith, and religion, hope is the ingredient in life responsible for a positive outlook even in life's bleakest moments. People express and experience spirituality in and through connectedness with other people. There's a basic human need to be loved and to love. And we cannot be spiritually whole, spiritually healthy, unless this need is met. Spiritual health or spiritual well-being is the condition that exists when the person's universal spiritual needs for meaning and purpose, love and belonging, and forgiveness are met. Spirituality is a broad concept with room for many perspectives. In general, it includes a sense of connection to something bigger than ourselves, and it typically involves a search for meaning in life. As such, it is a universal human experience, something that touches almost all of us, right? People may describe a spiritual experience as sacred or even transcendent, or simply a deep sense of being alive, or it could be interconnectedness to the environment, right? Some may connect their spiritual life intricately. It may be linked to their association with their church, temple, mosque, synagogue, right, etc. Others may use prayer as a personal relationship with God or a higher being, and others may see meaning through connectedness to nature or even art, right? Spirituality can take on several of these elements as well. And individuals' spirituality may change and adapt throughout their lifetime, right? It can adapt quite significantly. Different life experiences and relationships can definitely shape our sense of purpose on earth, right? An atheist doesn't have a belief in God or a divine being per se. An agnostic neither believes in God or religious doctrine, nor do they believe against it, right? And they assert that it's impossible for human beings to know anything about the universe, why it was created, and even if divine beings even exist. That's an agnostic. Although religious beliefs and practices can be life-affirming and can be a source of strength and healing, it can be a source of conflict as well. Sometimes religious beliefs conflict with prevalent healthcare practices. I have seen several friends who are Jehovah Witnesses. With Jehovah Witnesses, this religion prohibits them from having blood transfusions. This can be life-threatening issue in certain situations. However, whatever the person's decision about healthcare, remember that each person is unique and has a right to pursue his or her own convictions, even though they may differ from those of the healthcare provider. Look in your book about beliefs in healthcare practices of major religions, traditions in the U.S. You do need to know that information. Many factors can influence a person's spirituality. The most important of these are developmental considerations, families, ethnic background, formal religion, and of course, life events. The HOPE acronym is an example of one approach to spiritual assessment. These questions were designed as a starting place for healthcare professionals interested in the spiritual health of their patients. They may open the door for more in-depth discussions when needed. So the H in HOPE means comfort, strength, peace, love, and connectedness. By focusing on a patient's basic spiritual resources without immediately introducing the words religion or spirituality, these questions allow for conversations with people from a wide variety of backgrounds and beliefs, right? The O in HOPE is the organized religion's role for the patient. P, personal spirituality and their personal practices, right? And then E, the effects of the patient's beliefs and values on their medical care, as well as end life decisions, right? End of life decisions. So O'Brien looks at the spiritual assessment guide and specifically looks at when patients are in spiritual pain, when they feel spiritually alienated, when they're having spiritual anxiety, guilt, anger, loss, or despair. Religions have common characteristics such as a belief in a higher power, such as God, Buddha, Allah. Religious rituals or practices, and they also have a consistency like a moral or ethical code, right? So we have, again, a higher power, religious rituals or practices, and then that higher moral or ethical code. They produce an awe, sense of mystery, guilt, or adoration, right? A worldview or a general picture of the world as a whole and the place that the individual fits within it, right? They bring all of that. And some ideas about what happens when we die, right? What happens after death. Here are a couple possible nursing diagnoses for spiritual. I encourage you to also look at your resources for more. Our patients' goals and outcomes will be centered around their wellness in strength, forgiveness, and purpose. Again, look into your resources and come up with some possible outcomes as well as goals for these nursing diagnoses. These are great examples. Pause the video and read through them. Helping people meet their spiritual needs as the nurse sometimes can be simply being supportive, a supportive presence, right? You can always get the facility's clergy to visit the patients to explore their feelings more in depth and also to discuss possibly reaching out to other different spirituality leaders. You can call the patient spiritual leaders if they are associated with a specific religious organization and then ask them to come see the patient. Of course, this all requires the patient's consent prior. Ask them if there's anyone you can contact, anyone that they'd like to confide in. Keep in mind, a nurse's offer to pray for a patient may be received gratefully by one person and dismissed angrily by another, who may associate prayer with a last resort intervention when everything else has failed. So just be cognizant of that. Cognizant. The fact that some healthcare professionals confuse spiritual care with proselytizing. So proselytizing is when you try to convince or convert other people to your own religion. Don't do that. That is definitely not allowed, right? Keep to the spiritual history of your patient, right? They're the center, the patient. Recognize pastoral care professionals as experts in the field and consult them appropriately. Proselytizing is never accepted in professional settings, so addressing spiritual issues should not be coercive. More in-depth spiritual counseling should be under the direction of chaplains or other spiritual leaders. Praying with the patient should not be initiated by the nurse unless there is no pastoral care available and the patient requests it, or in situations in which the nurse and patient have a long-standing relationship or share a similar belief system, right? If the patient asks you, that's totally different. It's then it's okay, right? The nurse can stand in silence as the patient prays in his or her own tradition. The nurse can always make a referral to pastoral care so that the chaplain can lead the prayer if that's what they want to do. Most facilities have clergy in all religions that can come and provide prayer, services, sacrament, all of those things, right? They can offer them access to these services in the hospital, right? So we want to familiarize the patient with the pastoral and religious services and materials available within the institution. We need to respect the patient's need for privacy or quiet time during periods of prayer. We need to assist the patient to obtain devotional objects and protect them from loss or damage. Arrange for the patient wishing to receive the sacraments. Attempt to meet the patient's religious dietary restrictions. And arrange for the patient's minister, priest, rabbi, shaman, whatever, to visit if the patient so wishes, right? Some nurses are comfortable having these conversations with their patients. If you are not, look into resources for them. Contact your social worker and facilitate psychologists to gain a resource for your patients to receive counseling, potentially. Before exploring spiritual care strategies, remind yourself of the importance of discussing spiritual concerns in a respectful manner and as directed by the patients, right? The patient may want assistance when conferring with the spiritual advisor about a particular procedure. The nurse's role is to help the patient obtain that information, right? So they can have an informed decision and best support them in making that decision. Because what the nurse says and the way it is said may powerfully influence the patient's decision. It's very important to remain and maintain objectivity, okay? Make sure the room preparation for the spiritual counselor visit is orderly and free of unnecessary equipment. Provide a seat for the counselor near the patient's bed, right? You want to get them eye to eye on the same level. Clear the top of the bedside table and cover with a clean white cloth for sacrament. And then, of course, draw the curtains and, pull the door closed. Evaluating expected outcomes. In general, the nurse evaluates the patient's ability to accomplish the following. A sense of security and direction in the pursuit of one's life goals and activities, okay? This is the goal. Did we meet the spiritual goal for the patient, right? All right, this is the end of spirituality.